The MedSearch app is a health information directory that allows users who are in search of specific medications or health services such as hospitals, clinics, pharmacies, or even veterinary services to quickly and easily access what they're looking for. It's available on Google Play Store and you can find it on Apple App Store.
MedSearch Zambia Health Talk. I'm your host, Zangam Sakuzwe, the CEO and co-founder of MedSearch Zambia. If you're joining us live on Facebook, we encourage you to share with friends. We encourage you to invite family and friends as we look at an important topic. Very important. We have seen many people getting pregnant. We are seeing many mothers to be. Tonight, I'm joined by Dr. Bowa, my workmate, a friend. As we look at an important topic, I'll be bringing her on board right now. Dr. Bowa, evening.
Good evening, Zanga. Thank you for inviting me.
It's a pleasure for MedSearch to have you on board. We are really happy that you answered the call to educate us on an important topic, which is the importance of antenatal visit.
No problem. It's an honor.
If I know not true. Before we start, I think there's always one question that we usually ask people, who is Dr. Bowa? Where is she from? Where is she practicing from? We'd love to know the person that people be listening to.
Okay, so as Mr. Zanga introduced me, I'm Dr. Bowa. I currently work at Kafue General Hospital. Right now I'm in the ART department, though I have worked in maternity before in the antenatal department, and I do assist there sometimes. It's a good department. I think there's a lot we can talk about and bring a lot of awareness to the importance of it. So yeah, I'm the Kafue resident.
How's Kafue this evening?
There was lots of rain. It's wet.
Yeah, so you guys are experiencing the cyclone Anna.
The cyclone? I thought it was a tropical storm.
Yeah. Well, we'll get into it. We don't want to disturb your Friday. 2021 statistics by Ministry of Health showed that the ratio of maternal mortality in Zambia stands at 285 per 100,000 deaths in Zambia. We have reduced, it was at 400 some couple of years ago. We are reducing, but the number is still high. And we have seen this. And one of the things that it was attributed to is lack of information, lack of access to health services, people not knowing why they should go for antenatal, whether they should go for antenatal, them being home until the day of delivery. As a medical personnel who has worked in maternity before, the question stands, why should, if we're a married couple and we are expecting a child, why should antenatal be important to us?
All right. So pregnancy, number one, is very important. It's a beautiful process of growing a baby and bringing life into this world. But it can also come with a lot of complications that can happen at literally any point during the pregnancy. So if we're able to find those problems early on and treat them, then we can have a healthy mother and a healthy baby. And I do believe antenatal care can save lives and reduce on the maternal and neonatal mortalities.
Okay. There's always, I think, majority of women would always want to start. I think the first time couples would want to start pre-antenatal. I think even before before they know that they're going to expect a child. Others will come 3 months or 4 months after they're already pregnant. When should a couple start antenatal?
So the best time to start antenatal, as research proves, is within the first 3 months of pregnancy or the first 12 weeks. So I would advise a woman to start antenatal care as soon as she realizes she's pregnant. Reason being, it's the best time for us to accurately predict how many weeks she is at the time. There's lots of discrepancies with the number of months a patient is pregnant, especially the farther along she goes, and especially if she's not sure of her dates, if she's using family planning, it can distort the normal period. So we need to do a scan within the first 3 months. It's also important because the first visit is the most crucial. It's the time when we get to know the patient. It's the time we take a detailed history. It's the time we get to ask them what type of conditions do they have. Do they have any heart problems, kidney problems? Do they have raised BP? Do they have diabetes? We're also able to ask them what medication are they on. If they're epileptic, certain medications are not really good for the baby in the development period. So we need to find out all that, conduct tests on both the mother and the partner, and get to treat whatever we can find. So that's why I would recommend that the best time is within the first 3 months. But you are right, there's lots of misconceptions. Some people start late. Some people feel, no, you're too excited, you're starting too early. Or some people just don't know, they just see everybody going late. Some people just don't want to wait in line. They're saying, no, it takes so long, I might as well just start later on. But trust me, the earlier we start, the better.
So it is very important for, I think, majority of the couples to come, I think, the moment they realize that, let's say, if they realize to say, oh, I missed my monthly periods and we are pregnant, that is the moment they're supposed to go to the hospital, because I think you're saying there are many tests that should be done. So what if we were expecting and we come to the hospital, what do we expect? Is it just you now looking at us and looking at two people, hugging them and congratulating them? You'll be parents soon, and you tell us to go home. So what is expected when we come for antenatal?
All right. So the first thing you'll be given is a file or a book, and we'll get all the information. Let me just give an example of not really the book, the first visit, because we've talked a bit about that. Let me just talk about a routine visit within the pregnancy. And as that, we do give a minimum of 8 visits, as WHO recommended in 2016, or more, depending on how complicated the pregnancy is. So if they come for a normal visit, the first thing they'll do is take the pregnant patient's vitals, check her weight. If there's any problem, they immediately go and see the doctor. If there's no problem, they go and sit with the other clients and they're given health education, either by the midwife or by other people, such as the nutritionist. There they get to learn a lot of things, signs of labor. They get to know what to carry in the baby bag. They get to know just how to take care of a newborn, or how to take care of themselves during pregnancy, what they should eat, what they shouldn't eat, the common myths that they should avoid, and so on. After that, the screening tests begin, such as HIV test, syphilis test, the hepatitis test. And we do these tests because these diseases can be passed on to the baby. So it's important that we find those diseases and treat them early. So we do test the mother and the partner. After that, they'll have to wait until they're called into the consultation room. By the way, couples are prioritized during antenatal visits because we want the partners to return for work early and not lose their jobs. So we do make sure that they're seen as quickly as possible.
So now that is an encouragement to men to escort.
Yes.
Because
Yes.
during the course of the week, it was interesting how men were running away from it. Majority of them were saying, look, if I'm going to go to the hospital the whole day, how are we going to make money?
They don't have to ask for a complete day off. Maybe they can call their boss and ask, can I please take at least the morning off to escort my wife to antenatal? Because we want antenatal to be a family approach. They're both having the baby. It's a family that's growing. It's important that the partner is informed, because, you know, he might hear about a certain condition from his wife at home, but he'll be able to ask more questions if he's in the room hearing about the condition. And the woman also feels more supported, you know, you're not going alone, you're not alone in this. So I do encourage the men to come to antenatal and encourage their wives to start early. They should come early. Yes, you might find more women are happier, you find they're smiling more, they giddy more. So it really helps.
Which is good for the baby, hey?
Yes, even the baby's happy. Mom's happy, baby's happy as well.
Yeah. Right.
So they'll be allowed in the consultation room. Even the husband is allowed there. There, the midwife or the doctor will ask them certain questions, how they're doing, if there's anything they've noticed, and they're allowed to explain what they're feeling. And then after which the client will be examined. We'll check how big the baby is growing. Is the baby growing at the correct pace? Is the baby too big? Is the baby too small? Is the baby upside down, which we call breech? Many things that we check. And at that time, the couple can ask questions. You know, it doesn't have to be a silent, just how are you, you're fine, and nothing else is happening. They're able to ask questions. If there's something that they've noticed, they're allowed to ask, and we will answer those questions for them. So after the examination, we order certain tests at times. Maybe if we feel we need a scan to be done, it'll be ordered, or if we feel other blood tests need to be done, they'll be ordered. If all is well, the couple, well, the patient is given her medication, such as her blood boosters or any other medication like malaria preventive treatment. If she's due for her tetanus vaccine, if she's due for deworming, she'll be given those treatments. If all is well, they'll be given their next appointment date, and then they're allowed home.
You had mentioned about, I think you are in ART, and you had mentioned about the HIV tests. Why is it important that a couple should do that? I think this is one of the things that many women were complaining about. The syphilis test and the HIV test, majority of the men ran away from it. So like, what would be your encouragement to couples? Why should this be done?
All right, so this should be done, I would say, for the benefit of the mother, and most importantly, for the benefit of the baby. It's really sad to see a baby contracting HIV from birth. So we do these tests every 3 months to make sure we find it and treat it before it can be passed on to the baby. So it's good if we treat the mother, but it's even better if we are able to treat both the mother and the partner, because it will ensure that there is less cross-infection, especially for syphilis and even for HIV as well. So our main goal is to protect both mother and baby, because at the end of the day, we want a healthy mother and a healthy baby. If the mother already has HIV, yes, we will treat it, but we will control it, and then we will prevent the baby from having HIV. So it's mainly for the good of the family if they can test. It's good to know than not knowing.
And I think one thing, we have moved from, let's say, back in 1998, early 2000, where if a woman is pregnant, the chances of the child contracting or the child having HIV were high compared to now. We have seen a reduction in mother-to-child transmission reducing, and this is very important. And this is why, at the end of the day, those tests should be done. It is not that we're trying to separate you from your husband if you're a married couple. It is at the end of the day the benefit for you and especially the child. Zambia, together with WHO, have got the 2030 goal, the 95, 95, 95, and we're trying to ensure that by 2030 we should have no new transmission, and this can be done through such tests going on. During the explanation, you had mentioned one thing. What are some of the questions? Because I think majority of the people are afraid to speak out if we are a couple and we go for antenatal. We are afraid of talking. We don't ask any questions. So if you tell us to jump, we'll just jump. If you tell us to run, we'll just run. What are some of the questions that you can encourage couples to ask if they go for antenatal?
All right. So they can ask basically any question that they have. They shouldn't feel shy about asking certain questions. I had a client the other week who was not shy about asking anything she wanted, you know. if like, when I sleep this way, the baby moves like this. Is that okay? If I sleep this way, the baby moves like this. Is that okay? It sounds like a small question, but to her, it's a big question for her.
True.
You know, it's a big deal. So as healthcare workers, we should be open to any simple, small question that they have, you know, some, maybe let me not go in certain questions, details. The simplest question, yes. We get all sorts of questions, but they can be free to ask anything about the pregnancy, and we won't laugh at them, we'll answer them. And there's confidentiality. It's just us in the room. We're just talking. They should be open to asking anything.
Which is very important. I think majority of the people feel like if they're going to, whatever they're going to share with you, the fears of delivering and everything, people think as if the moment they walk out from your consultation room, it's more like you go on Facebook and say, yo, couple
Yeah.
A, B, C, D.
Yes. I guess it's why I didn't say some of the questions here. Confidentiality is important. I'm hearing to that. So yes, they shouldn't be afraid,
They shouldn't be
when we're
afraid.
dating, we're told confidentiality, it's part of ethics. We will not spread the information saying, look at what couple A and B said, we'll keep it, it'll stay in the room.
Some of the medications, and if you're watching and you have any questions, please do ask in the comment section. Dr. Bowa will be able to answer them later on. You had mentioned about some supplements that women are given. Why is this important, and what supplements do we give to pregnant women?
All right. So these supplements are important because sometimes they avoid certain complications. I'll give an example of the blood boosters that we give. We give folic acid and ferrous sulfate. And this is because anemia in pregnancy is very dangerous. A patient, when she delivers, she's always going to lose blood.
Yeah.
And sometimes she may lose more blood than normal. So let's say she loses more blood than normal. She already doesn't have enough blood. She may need a blood transfusion or other interventions that could be avoided if we had just boosted up her HB early on in pregnancy. And also folic acid is beneficial not only for the mother, but also for the baby, because we avoid certain complications with the baby, such as spina bifida. It has been found that it does reduce the risk because at times spina bifida is associated with low folate levels in women. And it's been seen that a lot of women are anemic, partly due to maybe it could be dietary intake, but it could also be heavy menstrual periods. There's many reasons why we become anemic, and sometimes we're not aware because we're so used to that low HB for a long time, and we only find out when we're pregnant. So those are some of the supplements we do give. It's not exactly a supplement, but we do give malaria preventive treatment. We use Fancida, and a lot of women don't like the taste, and sometimes they feel nauseated, and sometimes they do complain a lot about it, but it's important that we emphasize that this is better than having malaria in pregnancy, because the biggest fear with malaria in pregnancy is losing the baby. So we'd rather you just take that Fancida once a month than dealing with the loss of a baby because of malaria. Yeah. So those are some of the supplements. You can also take multivitamins. Some take multivitamins as well, but I guess for us, we focus more on those because of the reasons that I mentioned above.
And I think before the meeting, I know we had written what things to talk about and everything, but because of the excitement of you being my just now, like it's everything. The importance of antenatal. Majority of women in rural areas, traditional medication during antenatal periods. Like what are the risk factors of majority of the women with traditional medication during the pregnancy?
All right. So I do understand that people in rural areas maybe have difficulties in accessing medical services. So maybe just say that the traditional herbs they have is maybe their only medication that they can find nearby. So they do usually use them, and they do have certain properties that could be beneficial, but the problem is we cannot measure them, cannot quantify them. And sometimes it's very have an overdose. And problem with herbal medications is the risk of damaging the kidneys. Now, the herbal medication that we fear the most in our healthcare sector is that one that induces labor. A lot of people still to this day take that medication to try and
Serious?
yes, we given by their grandmas. The grandmas say, "I know this medication. You just take it."
It worked for me.
Yes, you give birth in 2 hours and you'll be fine. And they listen because they don't want to take so long in labor, because they do know that the first time pregnancy, they'll take long. And like you said, she'll say, I've done it before, it's worked and it's fine. But there's complications that can happen anytime. And the worst complication is losing the mother or the baby. And that can happen with herbal medication because it can make contractions too strong, such that the baby's life can be lost because of the strong contractions. The placenta can detach prematurely, or the uterus can just rip open and the patient can bleed to death. So we try to emphasize that they shouldn't try taking these medications, but we do still have some here and there taking them. And I think it will take some time for them to trust the healthcare system, but we'll keep trying, we'll keep pushing for them to trust that.
And I think this is now the importance of such meetings. Well, I think majority of the people I'm seeing on our page, a lot of people are liking the conversation because this is affecting many women, not knowing what to do. So it is about hearsay, or that I heard this, I read that, my parents said that. Hope with what you've told us, people will be able to understand the importance of visiting, having antenatal visits. Maybe now, I know we've answered majority of them. So why should these visits? How long do they take? Why should I be coming to a hospital? We've talked about the test. We've talked about, but why should I come? I can Google. Google will tell me what to do. I can ask my neighbor. They'll tell me what they did during their pregnancy, and I can adopt it, and I'll be okay. You talked about our grandmothers who've been our legend doctors ever since time immemorial. They know everything. I should listen to them. So why should I entrust you? Why should I be coming? I don't know how many times in a month. I don't know how many times before I deliver. Why should I be coming? Why is it so important for us as a married couple?
All right. So I'll mention a few important reasons why people should attend antenatal. The first reason, and the foremost reason, is antenatal can save lives. We're able to recognize these complications early on as the patient keeps coming for their reviews. I know for them it seems so routine and boring, but for us, we're seeing it in a totally different way. For us, we're seeing how's the BP, how's the urine, how's the baby growing. An example would even be high blood pressure. It can happen at any point in pregnancy. It can happen in the middle, it can happen towards the end. And sometimes the woman might not even notice that she has raised blood pressure. And the problem with that is it can be dangerous to the mom and the baby. So if we're able to pick it going high or pick it already high during an antenatal visit, we're able to say, okay, start taking this medication to lower this baby drugs. Okay, this is the delivery plan. We'll deliver you at this many weeks, and this is how we'll go. Then we'll be able to save a lot more babies and a lot more mothers. Another reason why it's important is you get the correct health education. Not what the word on the street, but you actually get information that's given by skilled, trained healthcare professionals. Starting with that group session that I talked about, where a midwife will be giving, should be giving education on certain topics, and also you asking questions in the office as well. That's another good reason you get accurate information. Another good reason is we're able to screen for diseases. Google cannot really do a test on you and tell you have syphilis or HIV. Yes, it will give you all sorts of symptoms, but you need proper testing, and you need to be informed about what's happening and how you're going to treat this disease.
Google will tell you your child has got cancer before it's been born.
Google always tells you have cancer. It will tell you that the mother, the father, and the baby have cancer. That's what Google will do. Yeah. So the reason people should come is, we're able to monitor the baby's growth. We're going to be like, okay, at this many months, the baby should be this big, or the baby shouldn't be this big. And we'll try to see, okay, why is the baby growing in a certain way? Because at the end, we want both healthy mom and healthy baby. This is a 2-in-1 that we need to keep. They're very precious to us, and we need to make sure that they are both healthy at the end of the delivery. We also offer guidance on family planning. There's some people who maybe they're done having children, but maybe they don't really know what methods to use after they deliver. So we've been able to offer that extra information about that. And yeah, there's so much more we offer in antenatal. It doesn't have to be a boring session of just coming, taking BP, being checked, going home. People can make it more of a learning experience. You should learn something every time you leave. And it should help you make good decisions about your pregnancy, when to come. Sometimes we talk about danger signs. We tell them if you're bleeding, come. If you have headaches or dizziness, come straight to the hospital. And it saved a lot of mothers and babies by listening to that and by acting like that.
Okay, well, I'll ask a question, but there's a question from Ali Chai. She says, I have a question. Does malaria make pregnancy out? Maybe she's trying to say if one has got malaria, does it increase the risk of early labor or yeah?
Okay. Yes, so malaria has been known to cause miscarriages early on if it's found early on. And even later on in the pregnancy, there is a risk of losing, not really going into labor, but actually losing the baby dying inside, because it's an infection. It's attacking you, and you can even get really sick. Now, what more attacking a little baby who doesn't even have any defense? So that's our main concern with malaria, is losing the baby. And pregnant women are more likely to have severe malaria than non-pregnant women. So at the first day, she may seem like she's just having a headache. Tomorrow, you'll find that she's fitting already, or she's lost so much blood. So that's why we emphasize on avoiding the malaria by giving those malaria preventive treatment, and also by giving mosquito nets whenever we have.
How often, there's another question, how often should people attend antenatal? Like, is it every month? Is it every day? We have to go and report, okay, in the last 24 hours, more like the COVID update, in the last 24 hours, she was breathing slow. How often how often are the visits?
Okay, so WHO recommends that every pregnant woman should have a minimum of 8 visits. They should have at least 8 visits from the time they started antenatal to the time they deliver. But they can have more. We can have maybe 15, 20 visits if we can, depending on what we find. For example, if we find the BP is going too high, we'll tell them, okay, come back in 2 weeks. Okay, come back in a week. Okay, we've noticed something abnormal with the baby. Can you come and do a scan in another week? So we do it as many times as possible. So they should bear with us. We're just trying to do our best for our mother and our baby.
Okay, thank you very much. So it's not every day. The other question is, what are some of the conditions that I should be aware of before delivering that might be a danger to both the mother and the child?
Okay, so there are several conditions in pregnancy that they'll need to be aware of. Maybe what I would advise is this danger signs or the symptoms, that if they experience this, they should seek medical attention immediately. And one of the first things is bleeding in pregnancy. No woman is supposed to bleed in pregnancy and just go on with their daily activities. It means that something is going wrong, and that they should seek medical attention about it. It may be a problem with the placenta, and it may affect the baby, so we need to seek medical attention immediately. If they're having symptoms of headache, dizziness, they feel joint pains, or if they have a fever, they need to seek medical attention immediately. I would say there's many more signs, but I think those would be the main signs that I would look out for. Or another sign I need to mention is if she starts noticing that her water is breaking early on, that's a very important sign. It means that she needs to seek medical attention immediately. And also, I guess, the general signs of labor. If she's having intermittent abdominal pain, she's having a back pain, noticing her tummy is getting a little hard at times, softening hard, and it's more consistent. And if she's noticing a bit of discharge that's mucus-like, it might be a sign of early labor, and she must go to the hospital immediately. Or if she's just having abdominal pain that's not really going away, she can still seek medical attention. I would say those are the main signs and symptoms that our pregnant women should look out for and seek medical attention immediately for.
Wow, I'm like here, like enjoying the conversation. The last question that I might have, because I think they are done, there are no more questions, and I encourage people, if you've got any questions, please do ask. The fear of going to the delivery room. So, like, mentally, you who's been in that room, who's delivered before, what advice would you give for someone to overcome that fear?
Okay. So yes, the delivery room it's a scary place for a lot of moms, especially the first time moms. And it's not an easy place to be in, you do get scared. You wonder what will happen, how will the labor pains be, and all. But I would encourage, especially first time mothers or mothers who are still afraid of the delivery room, to just know that you're going to be fine. You know, this is just a step closer to you meeting your beautiful baby. There are contractions, and the contractions do get strong, but try to stay calm, try to breathe. You know, if you need us to have a look at you, you can always call us, and you know, just try and be calm. It might seem scary, but it all works out in the end. We always do it. Well, we always do try to make sure that we always have a good outcome, and they shouldn't worry about it. They should expect a lot. It's a lot of new, there's a lot of new changes taking place there, but it's all a natural process, especially if it's a normal delivery. You know, the body is made in such a way that it knows how to go into labor, it knows how to deliver a baby. She might not even realize that she can deliver a baby like that, but it all happens naturally. So she should just trust that everything will be okay and just try to keep calm.
Okay, wow. There's a comment from Monde Wamunyima. He says, I don't know whether it's a he or she, but the comment is malaria can cause miscarriage, preterm labor, and can cause intrauterine fetal death. The mother can suffer from severe forms of malaria that can present with severe complications, injuring vital organs. I don't know if you have any comment to that.
I would say she's absolutely right. She's my workmate. And she's got a lot of
No
experience.
wonder.
A lot of experience in maternity. So exactly what she said is exactly right. Malaria can cause all that. So avoiding it is the best, I would say.
And I think at the end of the day, with this information, and this is now why we're encouraging women, not only women, sorry, this is why we're encouraging couples now to attend antenatal. There's been improvement in the maternal mortality rate in Zambia, but we know there's been an improvement, but still we have a long way to go. 233 still is a big number. We hope we can reduce less than 100. With our closing remarks, antenatal visits, what would be your closing remarks? What would be your encouragement to couples?
All right. So my encouragement to couples is please attend antenatal together, number one. Antenatal is a family-centered service. You know, we want both husband and wife to be there. Number two, to start antenatal early. The earlier we start dealing with the problems, the better. There's no point in avoiding the problems until the last minute. Let's deal with them as soon as possible. And number three, especially for those first-time mothers, let's ask questions. Let's be calm. Everything will be fine. I think those are the closing remarks I would give.
Okay, sorry, they're not closing remarks. There's a question. More questions are popping up. This is from Chongo Leah Nsama. She goes on to ask how many scans are allowed during the entire 9 months of pregnancy, and does the scan have an effect on the baby? I think this is coming from a first-time mother. The scan that they go, they have an effect on the baby, and why is it important to have the scan?
That's a good question. A lot of people have wondered if the ultrasound scan has any effect on the baby, but studies have shown that no, the baby does not get affected by the ultrasound scan. It is recommended to have at least minimum of 3 scans during pregnancy for each trimester. But you can do more according to the discretion of the healthcare provider. If they feel they need another scan to see something, they need to follow up, they need to see something, there is no limit to how many they can do.
Why are women doing it? Like, is it just to take photos of the baby and then come and show when the child is all grown up? Like, why are we doing it?
We're doing it, number one, in the first trimester. We do these scans because we want to have the exact number of weeks or the exact number of months that the mother is pregnant for, especially when we have those problems of last dates and all, and we get to know the due date better with the first scan that's done within the first 12 months. The second trimester, that scan is used to detect any abnormalities in the baby. It's where if we start seeing maybe dwarfism, spina bifida, or any other conditions that are that the baby has, we're able to find them during that trimester and start preparing the parents for what they should expect. In the third trimester, we are just getting to see how the baby is doing in general. How big, what's the size of the baby? How's the placenta? Where is the placenta? Because there's some conditions where the placenta is completely covering the cervix and the birth canal. So we need to know those things first. How's the baby lying? Is the baby lying in the normal way? Is the baby lying on the side? Is the baby breech? We need to know those things in the third trimester. Mainly, yes. It's mostly just for the general well-being of the baby. Sometimes we're even able to see cords around the neck, although sometimes that's not really a worrying factor. But yeah, it's just the general overview of how the baby is in the first trimester and helps us prepare for delivery.
Dr. Bowa, I've really enjoyed my conversation with you on the importance of having those antenatal visits, not only by the mother, but also the father joining in. Dr. Bowa explained there are some tests that are done, especially HIV and syphilis test, but it's the HIV test for me which is really important. As we aim to have the zero new infection by 2030, this is a step that we can take. If you're found with HIV, it doesn't mean it is now a death sentence. A long time ago, people would think like that, but now there is medication for both of you, and that medication will also protect the child. During your antenatal visits, there will be other things that the doctors will be observing. The scans that Dr. Boas talked about, seeing how the baby is. There are medications that you're given, supplements to help boost up your blood to avoid anemia. There is also Fansidar that is given for prevention of malaria because majority of the women are susceptible to severe malaria. We have enjoyed having you. We always ask one question. Dr. Bowa, do you have the MedSearch Zambia app on your phone? Or should we cut the conversation now?
Let me say, I will immediately download the MedSearch app on my phone as soon as this live is over.
Thank you very much. So for those who are watching, download the MedSearch Zambia app. It is an application that is free of charge. You can either download it on Google Play Store or Apple Store so that you're able to find registered health facilities that you're able to go to for your antenatal. Do not only depend on Google. Dr. Bowa said Google always tell you you've got cancer. It will tell you your grandfather, your father, everyone in your family have got cancer and the child has got cancer. The application will be able to help you know your closest antenatal facility that you're able to go to. Reliable information is what we're trying to achieve as MedSearch Zambia. It has been our Friday health talk with Dr. Bowa from Kafue General Hospital, my workmate and someone I look up to. Thank you very much. Till next time, here at MedSearch Zambia, we always say MedSearch Zambia means healthcare simplify. Have a good night. Thank you very much, Dr. Bowa.
Thank you for having me, and thank you everyone for tuning in. Bye.
Bye.
Zambia app, healthcare simplified.